Hello, and welcome to Lessons My Patients Taught Me. This is Dr. Elliot Davidson, Family Doctor, recording from Akron, Ohio. This is my first video podcast, so bear with me as we figure things out. In this podcast, we talk about lessons that my guests and I have learned over our many years in practice and teaching. Today, I'm excited to welcome to the podcast my friend and colleague, and now one of my bosses, Dr. Doug Harley. Doug and I first met in 2009 when I hired him to join our residency faculty. In 2015, he became my associate program director, and in 2019, he became the program director and leader of the residency. In July of 2025, Dr. Harley stepped up from program director to vice chair of education at the Primary Care Institute at the Cleveland Clinic. Dr. Harley is dedicated to his patients, medical education, and to organized medicine. He's had just about every leadership position available to a family medicine physician, and he's excelled in all these areas and has a wealth of experience to share with us today. Let me just tell you a few highlights from Dr. Harley's career. Dr. Doug Harley graduated from The Ohio University Heritage College of Osteopathic Medicine. He did his family medicine residency at Humility of Mary Health Partners, St. Joseph Health Center. He worked in a federally qualified health center, FQHC, for 4 years before joining our faculty at Cleveland Clinic Akron General in 2009. As I mentioned, he was my associate program director for 4 years, and then became program director from 2019 to 2025. He's been active in hospital leadership, including chief of staff, and very active in the state of Ohio, both in the osteopathic and the allopathic societies, where he's held nearly every office, including president. At our residency, he's played critical roles in all aspects of education and management, from curricular development to research to patient care. He's a professor of family medicine at both NeoMed and OUHCOM, and he's won many teaching awards, and his workflows and epic prowess are the envy of the rest of us. In addition to this, he's a bit of a Renaissance man, running his own farm, raising his own bees, and being our IT and tech guru. No wonder his patients adore him and students seek him out for teaching and mentoring whenever he can. Doug, it is a true pleasure to welcome you to the podcast. This is my first video podcast. Thank you for being my first video guest, a little bit of my guinea pig. Welcome.
Morning, Elliot. It's a pleasure to be on with you this morning. I know you've been trying to get me on to this for quite some time at this point, and I'm glad we were finally able to connect and move this forward.
Yeah, so let's just start off with a general question. What got you interested in medicine, and why did you choose family medicine as a specialty?
Yeah, that's a great question. So I'm going to guess, or I shouldn't say I'm going to guess. My interest in medicine started at a younger age, just interest in helping other individuals. I know that's kind of cliche, the normal medical school essay. Why do you want to join medical school? It's because you want to help people. That was kind of always been the piece of the puzzle for me, was doing that. My father actually did a lot with the emergency medical service, so I had kind of that exposure to the EMS side of things growing up. Did a lot with mission work abroad in high school and in college, and that was really what continued to solidify my interest in helping others. And medicine was really more the natural component of it. Ultimately, at some point in some part of my life, I want to actually do medical missions more on a longer term basis, as opposed to just like a week here or a couple of days here kind of thing. I mean, really be able to give back to the broader community from that standpoint. Family medicine was really more of a component in undergrad. I actually worked with a family doc, actually a DO. That was kind of partly my start of interest in osteopathic medicine. Was early on. Actually, undergrad school graciously allowed me to create my own elective, to which I basically got to shadow a family doc in his office during a whole semester. So it was a great way to earn credit, get a grade, but also really have great exposure to family medicine and see what all it was. His was still, looking back on it, a little bit less of the Marcus Welby type thing. We didn't do home visits. He didn't do any obstetrical care, but it was still seeing a broad range of patients. And that was really family medicine for me. And being at med school really solidified that part for me.
Yeah, well, thanks for that. You've been at this a long time. This podcast is called Lessons My Patients Taught Me. So, what are some key lessons that you've learned from your patients over the years?
Yeah, great question with that. I think, our patients are what or who teaches us to be better physicians, and be better clinicians and diagnosticians and so forth. I think, things that my patients have taught me is just to be humble, to listen, to not interrupt, to really be willing to work with the patient on the level that they are. One of the things that one of my mentors taught me years ago was don't be afraid to be vulnerable in front of your patient, in the sense of even your medical knowledge, of being able to say, hey, I don't know the answer to that, but let's look it up together. I did a lot of work in the emergency room and urgent care when I was in residency, and then when I was first in practice in family medicine. And this was back in the day when we had textbooks for everything, which I know is different for our students now. But I can remember walking into a room with a patient that had an undifferentiated rash, and we would grab our Habif dermatology book and go back into the room, and patient and I would flip through the book, and we would try to compare rashes and see what it matched up closest to, particularly if it was one that I wasn't quite familiar with at the beginning. And just being able to have those conversations with the patient, to be vulnerable in front of them, as far as you didn't have to be the source of all knowledge as a physician, but you could learn together and expand your scope together. And I think that's really been the biggest part of what patients have taught me, is to be humble on that part.
Yeah, I think it really improves the credibility that you have with patients if you can say, I don't know. I look things up in front of patients all the time.
Mhm.
And I can say, oh, that's a drug I'm not that familiar with, or let's check the drug interactions on this, or let's
Yeah.
check the adverse effects. You're saying you're having this adverse effect. I haven't seen this before, and make sure that that's not happening. I think when you say you don't know something, I think it actually increases their faith in you when you say you do know something, because because you've given them that balance.
Yeah, absolutely.
Now, you have a very comprehensive and organized approach to seeing patients. I think you're the envy of many in the office in that way. Tell me how that developed, and how that helps you deliver better care.
Yeah, no, great question with that. There's a lot that goes into it, as far as pre-charting, getting myself ready each morning for patient set, or even in the afternoon if it's the afternoon set, of thinking about what are the pieces so I don't miss. Really thinking about what my agenda is, but also kind of starting to think about what the patient's agenda, and the sense of what they might have concerns about, but also wanting to make sure that I'm not missing something that we might have gone over the last visit or two visits ago, or a test that came back abnormal, and really trying to make sure I'm keeping good notes of that, so that we kind of touch base back again on that. I think a lot of it stems from just wanting to make sure I'm not missing something, but then also making sure that we're refilling medicines on time or ahead of time, and really thinking about that comprehensiveness behind it. I think some of the other part is really focusing in on the preventative health component of it. So a lot of it's engaging my nursing staff and helping to and I know my patients love all the paperwork. I guess I'm kind of they're used to that from me, as far as what papers do I have to fill out today. But a lot of times that's screening questionnaires of things that we might be checking in to make sure depression's not a risk, or maybe, especially during COVID, alcohol abuse or misuse wasn't an issue, and really thinking about intentionally asking them to fill out some paperwork so we can maybe uncover some things that we might not have uncovered otherwise. And then taking that time to dive a little deeper, or if it's something a little bit more complex, maybe checking blood work and then rechecking back at a follow-up appointment. I mean, really trying to be intentional about making sure that I'm providing the best care for my patients.
How do you fit this in a regular visit? That's a lot.
That's also some of the reason I routinely run behind. It is just because trying to fit too much in too little space. And I think some of it might have been uh, wanting to do better for my patients when I first started in practice. It's not that we didn't do good in the FQHC world, But I first started out in the federally qualified health center world. And, we were operating off of 10-minute appointments, and it was all you could do to get through one problem in 10 minutes. And you always felt like I need to do a little bit more. But you couldn't because you didn't have the time, that there wasn't the ability to do that. And I think maybe it's a little overcompensating, or the pendulum has swung the other direction, that I'm trying to make sure to fit more into the visits from that standpoint.
Yeah. Now you include osteopathic manipulative therapy, or OMT, in your doctor toolbox. And we've even developed a full curriculum around this. Explain how this fits into how you approach patient care.
Yeah. And so I think OMT is a great additional tool that physicians can have in their toolbox, in the sense of it's a non-pharmacologic or a non-medicine method of helping patients with whether it's acute or chronic musculoskeletal pain or other ailments that it can have some assistance with, and really trying to navigate patients to help with that. A lot of times they're very appreciative of that. I have several patients that I've been seeing. I've been with Akron General for going on, 17 years now. And I have some that have been with me for almost that entirety of time, that I see on a regular basis. And we do OMT on the patient. I actually have one patient that has a debilitating chronic disease, that otherwise would have them possibly using a walker or a wheelchair, but our regular use of manipulation has kept this individual off of pain meds and walking with simple mobility devices, and really being able to continue to function. And it's been great to see that continuation of functionality without the use of medicines, basically.
To segue into medical education, you were program director after me. Your tenure included some very significant challenges, including the pandemic, including expanding the program by 40% at the same time. Talk about how you led the residency through this difficult period.
Yeah, no, great question. And I think you actually left one other part out of that besides the pandemic and expanding the residency program. That was around the same time, too, that we became part of the Cleveland Clinic. And that was a big change for our hospital as well. I was part of the hospital and exec team at that point. I think I was secretary treasurer of the medical staff whenever we became part of Cleveland Clinic. But I think really that expansion piece showed us a lot about ourselves, in the sense of what we could handle, our patient load, and so forth, and what our office space could handle. But I think that really did show us some strain points in the program, in the sense of making sure that we had the appropriate resources and so forth with that. I think us being part of the Ohio University Heritage College of Medicine TCC program, or the Transformational Care Continuum, which you were part of that initial startup, Elliot. But I think that also helped us to navigate those stormy waters a little bit better in the process of things, because having those additional resources of the social worker and the care coordinator have really helped us as a residency program to be able to focus more on the population health side of things, and really bolstered the support of not only the residents, but I think of the faculty members as well. Certainly the pandemic was a challenge for everybody, but I think banding together, I think that really showed us all how strong of a team we were in family medicine, to band together and really make sure that patients still got seen, even though it was virtual, at least on the outpatient side, but really showed us our strengths, and really where family medicine can shine in adversity from a national pandemic, and being able to step forth and continue to provide care for patients. Um, it's been great that we've been able to expand our program. I think that's been the amazing part of being able to put out more primary care physicians into our area, into the state. I think we've done a great job keeping our physicians, our graduates, within the state of Ohio. We do have some that have gone elsewhere, but it's really good to see that we've been able to still maintain that component of keeping those that are trained locally, relatively local from that standpoint.
I thought it was great how we were able to, as a country and as a profession, pivot to televisits, virtual visits
Yeah.
so quickly. Within 2 weeks, we were up and running, getting reimbursed for those things. So kudos,
Yeah.
to the government for allowing us to do that. I also thought it was great to be part of the Cleveland Clinic at that point where, a lot of smaller health systems laid people off, cut people's salary. We didn't have any of that at the Cleveland Clinic, which was great. We had, other challenges
Yeah.
to deal with, but we didn't have to worry about that.
Yeah.
We segued to video didactics
Hmm.
very, very quickly as well. And again, those are some challenges, and we lost a little bit of that personal touch that we're still trying to get
Yeah.
back. I think it was amazing how we all pulled together.
Absolutely.
You've been involved in organized medicine a lot, pretty much every role that you possibly could do. I wonder what inspired you to take on this active a role, and why do you think it's important for doctors to do that?
Yeah, no, absolutely. Organized medicine, I think, really, I would even back it out of organized medicine. I think physicians being involved, period, is one of the best pathways forward, whether that's in the organized medicine realm, whether that's at your hospital on a committee or leadership, or even locally in your community, I think is incredibly important because all of our voices matter in the process of things. I know I kind of take it to the voting piece, right? Every vote counts, but every voice counts from this standpoint. And we all have a story to tell. I think we all have the ability to move the needle. It might not seem like a whole lot at first. I always liken sometimes to when we talk about big items of almost like it's an aircraft carrier. And I'm in my little dinghy up against the aircraft carrier, rowing as hard as I can just to try to change its directionality a little bit. And I think that's where being involved can have that component because you can have that additional voice of the other individuals. I first started in getting involved in organized medicine actually as a second year med student. It might have even been in first. That part's a little fuzzy still. I can't remember exactly. But I do recall seeing a flyer on the billboard in kind of our community space at the med school about looking for students interested in helping to shape medicine in the state of Ohio. And I remember responding to it via email, and it was for the essentially student council of the Ohio Academy of Family Physicians. And that was my first kind of dive into organized medicine and attending some of the meetings in Columbus and really seeing other individuals that were also equally passionate about family medicine, about expanding its scope in the sense of getting more students involved. And really seeing then also attendings at that point, as you know, I'm a first or second year med student, and seeing these physicians that have been in practice for 20 some years or more and talking about the joy of being able to see their patients and practice in these communities. And that was inspiring to be able to hear that and be able to be a part of that. And, they welcomed you at the table. I got to sit at one of the board meetings, and the focus was on me, the med student, and they listened to our ideas and what we thought would work and really took those to heart. And I think seeing that was that spark that really started that fire and passion around how do we better influence the next generation in the sense of keeping that fire going for family medicine and really its goals of giving back to the community and taking care of the patients.
This is a theme that I've heard from a number of the guests that I've heard. If you want to do something in your career, start early, even as a med student, whether
Yeah.
it's education or whether it's research or whether it's getting involved in advocacy, might as well get started early because then you'll have more opportunities and more networking and that kind of thing.
Yeah. Yeah, it's funny, that even my time with the OAFP, of building those relationships, that's actually how you and I met as well. That first time that I was at one of the OAFP meetings, and Renee Markovich, who I had known for a long time at that point, came up and said, "Hey, are you interested in going into education?" And you and I met over lunch, and as they would say, the rest is history, right?
He said, "Please rescue me from the FQHC. I'll drive an hour. I don't care." And you're still driving an hour.
I still am.
So, to get personal for a minute, you and I both developed heart disease in our 40s. That kind of snuck up on both of us. How did that experience change how you approach your patients, how you approach prevention?
Yeah, no, that's a great question, Elliot. It's interesting because, there's a movie called The Doctor, and I cannot recall the actor that
William
plays.
Hurt.
Okay,
Yeah,
thank you.
I love that movie.
That was, to me, that was an awe-inspiring movie that I watched. I can't even remember when it came out, but it was some point in my career, and realizing in that movie how he goes through the patient side of things and how things look so much different on that side. And it's one thing to see it and think, I got to think about that every day as I'm taking care of my patients, as far as that adage of walking a mile in their shoes, would I do things differently? But then physically experiencing it myself, you realize just how much more there is to it, and how that really changes the way that you have those conversations when you have that shared experience of being able to talk with your patients about what things feel like, or what a test might feel be like, and those kind of things. I think that's the part that's changed the most, is my ability to connect with patients on that. I actually have a similarly aged patient as me that around the same time frame, they went through the same exact thing. And so that's a shared experience that the two of us have together, as far as having similar style heart attacks and those near death events with it, and just really seeing how that changes our perspective on life, and thinking about how to make every day count, how to make every day mean something for the future, I think is the biggest thing. At least that's how it's changed me in the bigger picture.
The other way I notice by being a patient is, like, when I get a test and I'm worried about the result, I want the result right away, the same day that I get the test. And I know that my patients are feeling the same way, right?
Yeah.
And
Yeah.
so we try to get the answer to them as soon as possible, hopefully the same day they get the test, because, it's like do unto others. That's what we would want done, right?
Yeah.
And so we're more aware of that when we have to go through it ourselves.
There's actually a new show out on Netflix right now called Ripple, and it was interesting. There was a spot where one of the actors is diagnosed with lung cancer, and he gets the call after the biopsy, and you can tell on the other end of the phone, the doctor is starting to kind of build the component before they give the answer. And the patient just interrupts and says, "Doc, just tell me what the result is. I just want to know." It's, because you're right. I think we always try to, seeing that side, we want to make sure that they get the information, but we're also essentially trying to land the blows a little bit softer and those kind of things. And sometimes just the patients just want, hey, this is what it is. Give it to me straight. Let me know what's going on. Then we can talk about the next pieces of it. And then we can show some of the empathy and all of that, right? But they sometimes just want to know right at the beginning, what is it? What's the problem going on? And I think that is part of it, because I think too, when I was a patient, I just wanted to know, okay, what did the EKG show? What did my heart cath show? It's not like, don't give me all the other stuff. Like, just tell me.
Right, right. Now, to segue again, you have a new role. You're now the Vice Chair of Education for the Primary Care Institute. That sounds like a big job, sounds like a big deal. Tell us about this new role and any specific initiatives that you're working on.
Yeah. So it's definitely been a change of pace, in the sense of going from being a program director of family medicine to now the vice chair of education for the Primary Care Institute, which encompasses family medicine and internal medicine and geriatrics throughout the Cleveland Clinic enterprise. So certainly a bigger set of an audience that I have now, including all of the residents and physicians and APPs. But I think the difference is it's more so focused on how do we help to provide better education to our residents and physicians and APPs, and enhance the experience of what they have exposure to when they're here as a provider, as a caregiver, and really focused on helping the patients. So we're focused on medical knowledge. We're focused on how do we help make them better communicators through things like our Ready course, and and so forth, and really being able to advance just the care that we're able to give to the community. And I think that's one of the unique parts in this new role is I get to focus on the bigger picture from that standpoint. So things we're focused on now are, how do we better expand our primary care to make sure that we're covering the communities? How do we better incorporate education centered around point of care ultrasound? How are we utilizing artificial intelligence and how can we do it better? Those are really some of the big pieces that we're working on is that part. And also, how do we also get more of our physicians to do primary care, to be those community docs, not just our family physicians, but our internal medicine docs to go more into ambulatory side of things and be out in the community. Because we do, as we saw in COVID, right? We have a lot of older physicians that are either retiring or close to retirement that decided in COVID that, hey, now's the time I'm going to take down my shingle and I'm going to go on with something else. And we really didn't have that backlog of up and coming physicians to fill in that spot. So we have a significant primary care shortage. And I think the more we can do to help give that next generation of primary care docs that can be out there providing for our communities, I think is going to be the better. So that's one of the fun parts about this role is really being, I guess, a cheerleader for our individuals in primary care and how do we help them to do a better job.
Well, let me ask you about AI because, we have a new tool, Ambience, for the
Mm-hmm.
primary care docs. I love it, actually. It's really helpful to me, creating notes in particular, and also the after visit summary instructions
Yeah.
for the patients is really great. I'm wondering what kind of feedback you're getting from other docs on this.
I think the biggest way to sum it up is game changer and life altering. Those are kind of been the themes that we've been hearing as far as the ability to really make life better. One, because it's eliminating more of that, what would they call pajama time, that after hours time when docs, caregivers were documenting on patient care. But it also, I think, is allowing us to honestly take better care of patients because when you're in the room, part that got lost with electronic medical records was the docs that focus too much on the keyboard or the screen and not really paying attention to the patient. So I think one of the things that I've heard from patients is this now feels like it used to feel, where the doc sits and talks with the patient and you have that eye contact and there's not that need for the break to, well, let me take these notes down. And so there's a lot more of that connection piece that's happened with it. And I think that's why it's been a game changer. Been a game changer for me from that standpoint as well, as being able to have a better focus on what's going on. And you can easily pivot in a visit because it's not like, oh, hold on, let me mark that down so I make sure I don't forget to capture that change of trail that we're on now because the AI is capturing all of that for us. And so it allows us to pivot and be able to cover what it is the patient wants to make sure that they talk about today.
Yeah, I love it the way it captures all the instructions that I give to the patient, no matter when they happen during the visit. I try to give most of my instruction at the end, but if I've happened to give something, talk about a specialist I want them to see or whatever in the middle of a visit, it captures that in the after visit summary, which I probably wouldn't remember to put all that in there if I was creating it myself. So it does a great job with that.
Absolutely.
Lastly, you are one of the busiest people I know. It seems like you really like to be busy, and I don't know how you navigate all these different responsibilities that you have. So how do you do that, and how do you recharge your batteries?
I take it one day at a time. That's really the big thing. Sometimes hour by hour and really trying to make sure that you're giving what you can to the spots. Sometimes, as my wife would tell me, I've not said no enough. So that's been one of my practicing saying no and not getting involved in too many things has been a hard thing to do, and especially when it came to the organized medicine side of things, of being involved in multiple different components. I'm even involved in the community as far as being on the Akron Art Museum board. But those are the kind of things too that help me recharge. So it's those function things that it's taking you out of the mindset, especially the art museum stuff, right? It's outside of medicine, even though you can make some linkages to as you look at art to medicine, but it really allows you to have those other experiences that allow your batteries to recharge and to find joy in the process of things. And I think that's also what organized medicine has allowed is kind of rekindling that joy. Because at the end of the day of, whatever, you may feel a little downtrodden depending on what happened, what diagnoses you had to share with patients. But sometimes it's those uplifting components that can really allow you to kind of reignite that spark that says, okay, this is remembering why I went into medicine. This is what drives me each day to continue to see patients because it's something that we love to do. It's not necessarily a job, right? It's not what I come to for a paycheck. It's what I enjoy doing. And, we just happily get paid for doing it as well. But being able to see the joy on people's faces as you share the good news with them and how they're doing, like their A1C's down, they hit their weight goal. All of those things are exciting moments to be able to share with your patients, or as they expand their family, they've added a grandchild or those kind of things are those exciting pieces to be a part of their lives for. I know you've had that with your patients as well as through the years of caring for generation after generation and really being able to have those conversations of, when you have one of the kids talking about their interactions with their parents and you take care of the parents as well. So you can understand some of the nuances of the family dynamics and how that really plays a role in how they're doing and how their mentation might be and those kind of things.
Yeah, I think it's important for us to not only create those moments of joy with our patients, but also share those with learners because I know they have some preceptors that are burned out
Yeah.
that do complain about the stresses of practice. So we have to counterbalance that with helping them find the joy in practice because you got to enjoy those little moments to kind of make up for the
Yeah,
tougher ones, right?
absolutely.
Well, this has been great, Doug. I really enjoyed having you as my first video podcast. Thank you for allowing yourself to let me experiment with you a little bit. I'm going to be having fun with the editing process, sending out some clips of the two of us, and I look forward to getting feedback from the audience on this.
Yeah.
And you have any final words for us today?
Just fun to share this new frontier with you as far as adding the video part to it. And, final thoughts would really just be nice, be willing to work with all of your team that take care of your patients because it really is the whole team that helps to move the needle forward and helping our patients and our communities.
All right. Well, thanks so much, Dr. Doug Harley. I really appreciate you being on the podcast with me today. And I hope everybody's doing okay out there, enjoying the beautiful weather that we have in northeastern Ohio. And remember, stay healthy out there.
Absolutely.